Hi, Catherine. Thank you so much for meeting with me today.
Hi, good to see you, Jess.
So, Catherine is actually one of our students' moms, and she is a speech and language pathologist. So, because it's Better Hearing and Speech Month, we asked Catherine if she would come and share about better speech and hearing, or at least the better speech part. Um, with our listeners. So, Catherine, tell us a little bit about what you do, and then we'll go from there.
Sure. Thanks so much for having me, Jess. It's great. We love working with your team. My name is Katherine Jang. I am a wife, a mom of twin daughters, a dancer, a scrapbooker, and a speech language pathologist. I actually went to school. I got my undergrad from Cal State Fullerton in communication disorders, and then I got my master's from Cal State LA in speech pathology. So that is something that when you're looking at speech pathologists, we all pretty much have the same training. You need a master's to practice. So whether you're getting speech therapy from someone working in a clinic or the schools or a hospital, we all have that same training through a master's level degree. And our group, I guess, organization that we work with is called ASHA, American Speech, Language, and Hearing Association. So if you ever have general questions about speech, you can always look at ASHA, ASHA.org, and there's just so many great resources on there, and it's been a wonderful organization to work with. I started speeching, as we say on the sly. I started speeching probably over 20 years ago. Like I went right out of grad school into speech, and I knew for myself, like I had done practicum work in the hospitals and the schools, but I knew I loved children. So the schools were the way to go for me. So I have worked at every level in the schools, preschool, elementary, middle school, high school, and adult transition.
Wow.
So I've worked with a lot of levels of students, and it's wonderful. So Jess, if you wouldn't mind, I'd love to share my screen and talk to you about what an
Absolutely.
SLB does. So, okay, hold on. Let me see my share screen.
And while
Sorry.
you're pulling that up, would you, if you can multitask, will you tell
Yeah.
us, as a mom of a learner with dyslexia,
Mhm.
what you see, you know, of your daughter and other students who have like speech challenges or speech delays and dyslexia?
Yeah. My daughter actually works with Miss T, who is one of the amazing tutors who works with Miss Jess's company. And as a mom, as a speech pathologist, like I always kind of was like, something's going on here with my daughter. I couldn't really put a finger on it at first because you could have overlying speech disorder with dyslexia, but you also could have no speech disorder with dyslexia. So when I was realizing something's going on, like she was starting to really struggle with her reading, which in about kinder first grade, I requested that the schools do an assessment, and I had them assess her across the board. And that's when we really got that diagnosis for dyslexia. And actually, her speech came out strong at that point. But there are kids that have both and separate too. But yeah, okay. So let's see. What does an SLP do? Can you see the shared screen, Miss Jess?
Yes.
Okay, awesome. So SLP is speech language pathologist, and we work on all kinds of communication. And I mean, we could also work on feeding and swallowing if you're in a medical facility. We do evaluations and treatments. Like I said, we have a master's degree and we work with ASHA. So One of the areas is speech, which would be your sounds and sound production. And most of the time when I'm talking with people and tell them I'm a speech pathologist, a lot of people just think, oh, you just work on kids' sounds and that's it. But there's just so much more to speech pathology that I'll go into. So we do work on sounds, producing sounds correctly so that others can understand. And I'm going to do a little flash screen right now. Get ready. And side note, if you would like to access any of these resources, I would love to take credit, but they are not mine. They are made by other speech language pathologists who are very much more technically inclined than I am. So you could look on tpt.org, or you could email Jess and she'll forward to me and I'll send you the link so you can access these.
Thanks, Katherine.
You're welcome. So this was made by one of my speech language pathologist friends, and it just shows the ages at which sound should be coming in and have mastery. So at the age of 3, we would expect M, P, W, H, N, and B to have mastery. And so that would mean that your child and or student would be saying these sounds correctly all the time. And so as we get older, more sounds are coming in. And the latest sounds to come in are that R, Z, TH sounds. That R sound is just brutal on some kids, and some kids it just doesn't even roll in till about 2nd grade. It just takes the most muscles of your tongue to create that R sound because you're kind of going with your tongue. It's a really tough one. So we do see that one a lot in the schools R, and then sometimes this S and Z with lisps. We'll see that also a lot in the school. So that is the sound breakdown.
So I don't see any vowels there.
No, yeah, would be the consonant chart. Yeah, usually the vowels will come in a little bit earlier, but I mean, yeah, it's not very often that I have kids working on vowels.
Really?
I've never had anyone ask that, Jess. Yeah.
Well, that's a major thing for our dyslexic students, is the vowels. I actually just did a placement appointment with a student who's coming back after taking about a year and a half break. And she worked for a very long time with her tutor on sounds, and she still has not mastered the correct sound for the short E. So that's so interesting.
Like saying it or reading it?
Either, or writing it. She spelled wrong too. She said for E. So it just threw her off completely.
Wow.
Yeah, her tutor will work on integrating, practicing that sound with her when she starts back up this summer. Yeah.
Oh my gosh, that is so interesting to hear. Thank you so much for sharing it. Yeah, we don't have the vowels on the sound chart. Yeah. I'll have to investigate that a little more. Awesome. Oh my gosh, awesome. All right, cool. So back to the speech thing. Okay, so articulation of sounds, and then fluency is another area that we would work on. So if a child stutters or if they don't stutter, and there definitely are different ways to think about stuttering, because we have what's a normal stutter, a developmental stutter, and then a disordered stutter. So a normal stutter would just be like Jess and I are talking and I'm like, yeah, let me tell you about what I was going to say. So I put some interjections in there. So I put likes. Everyone does that 10% of the time. It's very normal. And then there's developmental stuttering, which is somewhere around like 2 years old to about 5 or 6, when you're really getting a big burst of language. And so you'll hear a lot of the little kids, they'll start repeating whole words and phrases like the dog went to the store. And so that is very normal as well. Those whole words and phrase repetitions when you're getting that language burst. Now, if you do have a concern with stuttering disorder, what you're going to hear is a part word repetition. So it'll sound more like, I saw the rabbit, or a prolongation of, I saw the rabbit, or a block where you'll see like stress on the face, like I saw the rabbit. like something like that. So it's a little bit different. And really, if you have any concerns with stuttering, I would reach out to a speech language pathologist to get a little fine tune of that. It does tend to run in families. It does tend to run 3-to-1 boys to girls. Usually around puberty, it'll get a little worse or better, but it is something that sticks with you for your life, and it goes through like ebbs and flows, and it gets worse in stressful situations, and it gets better when you're chilling out. So it is something that is definitely helpful to work with a speech pathologist. Voice, which is more of a medical speech issue. You sometimes see it on people that do sports if they're yelling so much like "go team" all the time, and then they sound kind of raspy. That could be because there's some blisters on their vocal folds. So your vocal folds are going to come together like this in a healthy way, and it's going to be nice and wet in there. And sometimes if you're yelling a lot or you're doing a vocal abuse and you maybe don't even know you're doing it, you're going to kind of do like this, and it's going to make little blisters in there. And so for a school pathologist like me, I would refer that out to medical, but that is definitely something where the speech pathologist would train you on like life skills on how to like calm in situations to help your vocal cords come more smooth and calm. So these, it's so funny because when I'll talk to people, Jess, they're like, oh, that's what you work on. And really, less than 25% of my job is that. And most of it is working on language. And people just generally don't think like language is what I work on for speech, but it is. So one part of language is AAC. And so that would be for students that are nonverbal or just could use some visual supports as well. So they could be just something as easy as just having a picture schedule. Like for myself, I love to-do lists. So I have my to-do list, check them off. That's a visual schedule. Your calendar is a visual schedule. We have all these kind of different visual schedules that we could work with for our students, as well as total communication devices. So things with iPads all the way to Dynavox. There's all kinds of different companies that do these and help students all the way through adults to work with getting communication going, even if you're not able to speak or you need support. All right. Language. Oh my gosh, we have so much to talk about language. So this would be either understanding language or speaking expressively. And this could be anything from understanding the meanings of words, which is also known as semantics, or vocabulary that has two meanings, like, oh, that's a nice light in my house. Oh, this is light as a feather. Or following directions, understanding what you're reading. All of these kind of tie in. And also expressive language, saying your vocabulary, making sure you're using the correct grammar when you're speaking, definitions, storytelling, making sure like stories come in the right order, first, next, last, prepositions, as well as social skills. And social skills can really bridge over into all sorts of things. I know occupational therapists work on it, behaviorists work on it, speech work on it, teachers work on it. And so just for speech, what we look at is the communication, the social communication, making sure that our students and children know what to say in a social situation. So they are turn taking, they are staying on the topic. So if Jess and I are talking about speech right now, I'm not saying, hey, Jess, guess what? I went and saw Spider-Man last night. Like that wouldn't be correct. So we talk about that in a social group of like staying with the topic, interrupting, turn taking, taking the listener's perspective. It's really fun to play all kinds of games you could do. There's so many great games. Like I love apples to apples at home because we can play that and tell our children, hey, like I want to play this card so bad, but I know daddy or sister or brother they're not going to pick that card, so I'm not going to win. So we have to learn that listener perspective or other person's perspective of what they would want to do. It's just so fun. There's so many great games. Inferencing, answering why questions. I have one more thing to share, Jess. Can I keep going?
Absolutely. This is great. And I want to say, my youngest son, he took speech therapy a couple of different times in his life. And I did not know about the language part until someone told me about it.
Yeah.
And so when they offered him speech therapy, when he was like 12, they wanted to just work on two letters. And I was like,
Hmm.
okay, that's not worth it. And then I found out that they could help him with his communication skills. And so
Yeah.
he ended up with his a couple different speech therapists for like 3 or 4 years. And then they were like, well, he doesn't need it anymore. He's graduated out. And I was like, no, don't take it away.
I know.
So, I mean,
Yeah.
it was an amazing, experience. They ended up helping my son with his writing skills because it
Oh,
overlapped with his,
yeah.
verbal skills. Yeah. So
Yeah. I
anyway,
love that. I know. It's such a nice setting. Usually for us speech pathologists in the schools, we're in a small setting. So we generally have groups of anywhere from 1 to about 6 tops, and it's just so nice to get those bonds with the children and, have really build those communication skills. That's so great. Thanks so
yes.
much for sharing that, Jess. That's wonderful. Okay, so this was the other one I wanted to share with you. So if you're out there and you're thinking, "I, my son or daughter, maybe they need speech," or maybe you're like, I don't know, I'm not sure. This is the questionnaire that I love to send home. Like if a parent would call me and say, "Gosh, I think, maybe my son or daughter needs speech," I would send this home and have them complete it. So if this is something that you would want, you can find this. One of my wonderful speech friends made it. It's on Teachers Pay Teachers, tpt.com. Or you can email Jess and she'll forward to me and I can send you the link. So it just kind of tells you things to look for. So I'm going to scroll up and it would start with like, if you had speech concerns. And it kind of starts right here with articulation. So if you had like concerns with sound production, so that's usually the first place people think like, oh, my son or daughter might have sound concerns. And you could easily just check that and send it to the school or the hospital or the clinic or wherever you are find a speech pathologist. And then this is the area that I find helps parents a lot because like a lot of parents don't realize that language is concerned. So it breaks it really down, like following classroom routines, following directions, using prepositions, using repeating a sentence, understanding questions. And there's just so many things that are included in speech. And I love this questionnaire because it kind of breaks it down and you can look and think, gosh, that is my son or daughter has difficulty with that, or oh gosh, they don't. Maybe it's something just reading related. Maybe it's not speech, maybe it's reading, but it kind of breaks it down. Explaining situations, retelling a story, sequencing events, repeating takes longer than peers to respond. And then it even has on here like the pragmatic social skills we were talking about, like eye contact, appropriate body language, personal space, initiating conversations. So maybe your son or daughter is able to have a conversation, but initiating the conversation on their own is difficult. Revising messages that kind of maybe had a little breakdown, telling their wants and needs, sharing their feelings, understanding humor. Like when we get into those phrases, like those higher level, like middle school and high school, like I'll have some goals that will address like figurative language and idioms, like you're pulling my leg, like understanding I'm not actually touching your leg. We're talking about joking. So going through and making sure, looking at humor, talking about slang, making sure kids understand what slang is meaning and it's not just blowing over their head. And then fluency in voice, which we touched on earlier. So yeah, this is just a great questionnaire if you had questions about speech.
So if parents find that their children have quite a few things in a particular area, do you recommend that they reach out to the school and ask for
Yeah.
comprehensive testing, or what's your recommendation on that?
That's generally what I would do. Like when my friends or family has asked me, gosh, I think there might be an issue with speech or language. I generally refer them to the schools. If your child is under 3 years old, it would probably be more of a referral to like a regional center program, but anywhere from 3 to diploma bound, because that age so varies now where you could get your diploma. I would reach out to your home school and just submit a letter that says, I'm requesting a speech language pathology evaluation. And if you feel like there's more, including maybe dyslexia or reading or occupational therapy or fine motor or gross motor, or PE skills, anything, I would submit a written letter and just say, this is the evaluation that I'm requesting. And then the school district will respond to you within 15 days to get back to you to get that evaluation started. And then that opens a 60-day window to test and then the review of the results after that. So that's what I
Awesome.
would do. And that's what I refer my friends and family to do as well.
Awesome. Thank you so
Yeah,
much.
you're
This was so
welcome.
informative.
You're welcome. And I just love, oh my gosh, like as a parent, I can't give enough shout outs to your company. Gosh, my daughter's diagnosed with dyslexia and she just adores her tutor, Miss T. And I have to say, like, I had been referred to Lexia learners and my first phone call was with Miss Jess, and Jess, you were so patient and you spent almost like an hour with me on the phone just going through all the questions. And our family just adores your company and we've been with you for years now, I think now, and we'll stay in for the long haul. I adore you guys. Thank you.
Well, thank you, Catherine.
Yeah.
That's so sweet of you.